Alright, number 10, general surgery.
General surgeons have a significant amount of medical knowledge, so they can operate on a patient with a variety of injuries and conditions. They assess patients, diagnose their conditions, prepare them for surgery, operate on them, and manage their post-operative care. General surgeons commonly operate on the skin conditions, the abdomen, soft tissues, and other body parts. General surgeons make about $200,000 averagely a year.
Number 9, oncology.
Oncologists treat cancer patients. They explain each patient's diagnosis, stage, and patients throughout their treatment, helping them manage symptoms of disease and radiation therapy. They might further specialize in medical, surgical, radiation, pediatric, gynecologic, or hematologic oncology. Oncologists make about $250,000 per year, including bonuses and paid vacation.
Number 8, orthopedic surgery.
Orthopedic surgeons diagnose, treat, and prevent bone, joint, muscle, and soft tissue injuries and conditions. Some treat all types of musculoskeletal issues, while others focus on certain body parts such as hips, knees, feet, ankles, spine, shoulders, elbows, and hands. They might encounter traumatic injuries, birth defects, cancers, or infections. Orthopedic surgeons often repair broken bones, damaged or arthritic joints, and injured tendons and ligaments. Orthopedic surgeons make averagely $300,000 a year.
Number 7, urology.
Urologists treat urinary tract and reproductive system problems in both men and women. They must have a deep understanding of and experience diagnosing and treating conditions of the bladder, kidney, urethra, male genitalia, and more. These might include infections, kidney or bladder stones, urinary problems, cancers, and male infertility. Urologists assess patients and run diagnostic tests such as ultrasounds, CT scans, MRIs, tissue samples, urine tests, and urinary tract scopes. Their knowledge base typically includes internal medicine, surgery, and gynecology. The urologists earn about $350,000 per year.
Number 6, plastic surgery.
Plastic surgeons repair or reconstruct external body parts such as facial features, breast, and skin. Sometimes they perform cosmetic surgery to improve a patient's appearance. Other times they perform procedures to repair damage from an injury, burn, disease, or deformity, such as a cleft palate. Technique plastic surgeons might use include skin grafts, facelifts, liposuction, breast implants, and tissue transfers. Some plastic surgeons focus on one part of the body, such as a face, or specific conditions such as burns. Plastic surgeons make about $400,000 a year.
Number 5, gastroenterology.
Gastroenterologists diagnose and treat digestive system disorders. These conditions might affect the stomach, intestines, liver, pancreas, or gallbladder. They often see patients with heartburn, diarrhea, gastric ulcers, abdominal pain, acid reflux, and digestive organ cancers. Gastroenterologists run tests such as diagnostic imaging and scopes. They understand how the digestive system processes food, absorbs nutrients, and removes waste. They prescribe medications and provide nutrition advice for patients dealing with conditions such as celiac disease, irritable bowel syndrome, and Crohn's disease. The gastroenterologists earn about $420,000 per year.
Number 4, radiology.
Radiologists perform and interpret diagnostic imaging tests such as X-ray, CT scans, and PET scans, ultrasounds, and MRIs. They might also perform mammograms and oversee cancer patients' radiation therapy. Radiologists typically work closely with the patient's main doctor to choose the best diagnostic test and recommend treatment based on the result. They understand how to read each type of image, how to perform diagnostic imaging properly, and how to use radiation safely when diagnosing and treating diseases. Radiologists make averagely $460,000 a year.
Number 3, anesthesiology.
Anesthesiologists administer medications, sedatives, and nerve blocks to prevent patients from feeling pain during surgery. They work closely with surgeons during procedures to make sure the patients receive the right type and amount of anesthesia. They also monitor patients' vitals of pain and adjust medications as needed throughout surgery. They understand how to handle drug reactions and side effects. In addition to surgical patients, anesthesiologists might provide pain relief for those people with chronic discomfort or disease. Anesthesiologists earn about $500,000 per year.
Number 2, cardiology.
Cardiologists diagnose, treat, and prevent heart and blood vessel diseases such as heart failure. They evaluate patients' medical histories and measure blood pressure, blood flow, and other parameters to assess blood heart function. They might run tests such as X-rays, blood work, exercise tests, and electrocardiograms (ECG). Based on their findings, they might prescribe medications or recommend diet or lifestyle changes. Cardiologists can also perform surgical procedures such as heart transplants, bypasses, and heart valve repairs, and insert pacemakers and defibrillators. Cardiologists make an average of $520,000 a year.
And finally, number 1, dermatology. It's all about skin.
Dermatologists diagnose and treat skin issues. They might treat acne, skin infections, eczema, inflammatory skin disease, skin allergies, and skin cancers. They perform skin exams, allergy tests, biopsies, and cancer screenings to diagnose conditions. Dermatologists earn about $550,000 per year. All the data we accumulated is from the American health system. If you're interested, you can check out other countries as well.
So thank you guys for watching, and that is it for today. And if you have any other suggestions, like maybe you think you disagree with the data we just provided, you can comment below. You can comment what you think is the richest medical specialty, and we'll do research on it and get back to you.
Exactly, and don't forget guys, we do this for you. So make sure to put some interesting topics in the comments that you want us to discuss about, and we'll definitely do that for you.
Okay, thank you. Please like and subscribe.